Hey guys, Dr. St. Jean here at thechicagochiropractor.com. Thanks for tuning in. This is video 3 in the Reduce Your Inflammation, Reduce Your Pain video series. In this video, we're going to talk about how you can use exercise to reduce your inflammation and therefore improve upon your pain. Lots of great information coming your way. Keep watching. Now here's the truth. Exercise can both increase inflammation and lower inflammation. You're probably thinking, what? The reality is, it depends on the context whether or not this is a good or bad thing. Effective exercise is technically inflammatory exercise. It creates an acute stressor that produces a powerful but temporary inflammatory response. And that's fine as long as the inflammation comes back down. Now, when we over-exercise or we don't rest enough, that takes it from an acute situation and makes it chronic, which is a recipe for more inflammation and more pain. Therefore, an effective training regimen would be one with a lot of different acute stressful training sessions, different times that you select to exercise, intermingled with periods of rest and recovery, that being just simple rest and relaxation or sleep, as well as good, solid nutrition. And that's what it should be. You have to have these little perturbations of acute stress, and then you have to recover. Perturbation of acute stress, recover. That's the recipe. And so a little bit of acute inflammation in the form of exercise produces long-term reduction in inflammatory markers. So a little bit of inflammation is a good thing because in the long term, your overall inflammation and the inflammatory markers that we can measure on lab tests are going to reduce. And there's a ton of studies. That provide evidence and links between an increase in physical activity and a reduction in inflammatory markers like C-reactive protein, CRP, and many more. So what's my main point? Well, don't over-exercise. That's the first thing. Don't over-exercise and make sure you adequately rest. Long-term consistent physical activity will reduce inflammatory markers. And overall, if done properly and effectively, exercise is extremely anti-inflammatory. So now that you know that exercise is definitely anti-inflammatory, what a lot of patients end up asking me is, that's fantastic, but what is the best exercise that I should do? Is there a specific one or is there a specific type? And really that depends on so many different factors, right? What are your goals? What are you trying to accomplish? Are you just trying to get healthy, or are you trying to be a figure competitor? Do you have a specific sport that you're trying to get better at? What is your fitness level? Have you not worked out in a few years? Do you only work out a couple times a month, or is it an everyday, maybe a multiple times a day? What's your age? That's going to be another major factor in terms of the volume and intensity that you can handle and what's appropriate. Do you have any injuries? That's obviously an important factor. And then, of course, any concomitant health conditions. What if someone has an arrhythmia? We might not want someone with an arrhythmia to do really, really high intensity interval training right off the bat. That might be something reserved for well down the line. So all these factors will help determine what types of exercise are most beneficial for you. So again, it's really difficult to give you concrete, very specific advice on which types of exercises will be beneficial for you unless I see you. But this is an example of the flow that occurs in this facility, in this clinic here. And that is the patient first comes in, and the first thing we're trying to figure out is, are they in active pain? If they're coming in with low back pain or knee pain, then we're going to shuffle them right into therapeutic exercise, also known as rehabilitation, as soon as possible. Some patients can't go right into it and they need some more acute care, more intense soft tissue adjustments, things like that. But typically we're going to try to shift you into the active form of care, therapeutic exercise and rehab, as soon as possible. If there's no injury, or once we've calmed down the pain and we're starting to treat the injury and it's getting better, then we shift the focus and we move more into this category, which is a combination of postural corrections, so we're improving upon any muscular imbalances so that you have actual good posture and enhanced mobility. And then we're going to be going into body weight calisthenics. I'm huge on body weight calisthenics. Check it out on my website. We have a whole club. It's called Lincoln Park Calisthenics Club, where a bunch of people from around the community, we go out and we work out on those bars and we get really specific in terms of what we're accomplishing. It's a fantastic group. Check it out. Also, we do balance training. Balance training is huge, not just for the elderly, but for everybody, right? You want to be able to balance when it's, especially in these Chicago's winters, because you're walking around, there's black ice everywhere, but also it enhances mobility and functionality of the entire musculoskeletal system. And then, of course, HIIT training and endurance training. Endurance training is to increase that aerobic capacity, make sure we're getting oxygen uptake to the muscles. HIIT training stands for high intensity interval training. The intensity of which we use that depends on the person. It's not for everyone. We can really dial it up or we can dial it pretty much down. It just depends. So this is the general flow of how we go about it. Regardless of what type of exercise methodology you choose or how you apply it, the exercises should always be functional. That is so important, and we like to use functional primal movement patterns. We're making sure that every program that we're doing are including these movements. So things like squatting, lunging, bending, twisting, pushing, pulling, and gait, which essentially means walking and running. So if you're not including functional movements, it's going to be really hard for you to see these positive outcomes you're achieving clinically and see them actually translate into real world situations, because when in the real world, everything's about functionality. All right, great. We just finished video number 3 in the Reduce Your Inflammation and Reduce Your Pain video series. We talked about how exercise is anti-inflammatory and ways you can safely and effectively implement exercise. If you want to learn more about how you can exercise safely and how you can use it to get out of pain, go ahead and schedule a consult now with myself. The link is right underneath this video. Otherwise, keep watching. We got more great information coming your way. This is Dr. St. Jean. I'll see you next time. Bye-bye.